All right, future pediatric nurses, welcome. Today, we're going to break down three really interconnected and honestly critical areas of pediatric care: hematologic, immunologic, and neoplastic disorders. Okay, let's just dive right in.
To really get a grip on what goes wrong, we first have to understand what normally goes right. And for so many of these conditions, the whole story starts deep inside our bones with a process called hematopoiesis. This is basically the body's own blood factory, and it's working 24/7, producing all the cells that keep us alive and kicking.
So, here's our game plan. We'll start at that blood factory, then we'll look at what happens when red blood cells start to fail. From there, we'll cover the basics of pediatric cancer, look at some specific types, and then we'll wrap up with immunity and some of the most advanced treatments out there today. Okay, so first things first. Let's start with the basics. Pretty much everything we're going to talk about today is rooted in how this incredible internal manufacturing plant works, or in some cases, how it doesn't. So, hematopoiesis, that's the one process that creates all our different blood components. And I want you to burn this number into your brain: 120 days. That's the normal lifespan of a healthy red blood cell. The moment that lifespan gets cut short, or the cells are just made wrong from the start, that's when we start to see some serious problems. So, let's see what happens when that process breaks down. When your red blood cell production or function gets messed up, you get a condition called anemia. Now, we're going to compare two really different types that I guarantee you will see in your pediatric practice. Take a look at this. The visual difference here is just striking, isn't it? On the left, you've got these nice, healthy red blood cells. But on the right, see how they're small and kind of pale? That's classic iron deficiency anemia. It's the most common type, and a lot of times it's just a dietary issue with picky toddlers. But the consequences can be serious. Things like poor growth and delayed development, which are absolutely key nursing assessments you need to be watching for. This table just lays out the contrast perfectly. See, iron deficiency is an external problem. You're just missing a key building block, so the fix is pretty straightforward. You give iron. But sickle cell, that's an internal genetic problem. The cells themselves are made with the wrong shape, and this causes these episodes of excruciating pain called a vaso-occlusive crisis. And it's so important to get this. These crises aren't just about pain. Every time blood flow gets blocked, it causes long-term organ damage. So our interventions are all about support, oxygen, tons of hydration, and getting that pain under control. And this right here, this is probably one of the most important things you will ever teach a family: dehydration. It makes the blood thicker, which makes it way easier for those sticky, sickle-shaped cells to clump up and block a vessel. Just teaching families how important it is to keep their child hydrated is a hugely powerful nursing intervention that can literally keep kids out of the hospital. All right, let's switch gears and talk about neoplastic disorders, or cancer. This is an area where the nurse's role in super careful assessment and safety becomes just absolutely everything. You're going to see this term everywhere: neoplasm. All it means is new growth. Our job is to understand what that uncontrolled growth really means for the patient, especially when it's malignant, and how the treatments for it are going to affect every single system in a child's body. Okay, this is one of the most important numbers in all of pediatric oncology: an absolute neutrophil count, or ANC, of less than 500. Neutrophils are a type of white blood cell. They're like the body's frontline soldiers against infection. When that count gets super low, we call it neutropenia. It means the child's ability to fight off even a simple cold is basically gone. This one number changes everything about how we provide care. And when that ANC drops below 500, these precautions, they are not suggestions. They are life-saving rules. In that moment, we are the patient's immune system. That's why there are no fresh flowers, why everyone wears a mask, and why we are constantly watching for the tiniest sign of infection, because their body just can't fight back on its own. Okay, let's get a little more specific now and actually look at some of the most common cancers you're going to run into in pediatrics. First up is leukemia. And you need to know this one because it is the king of childhood cancers. It accounts for almost a third of all diagnoses. This is a cancer of that blood factory we were talking about, the bone marrow itself. So here's the fundamental problem. The bone marrow just goes haywire. It starts pumping out tons and tons of useless, immature white blood cells. And these useless cells take up so much room that there's no space left for the good stuff. So what happens? The patient shows up with symptoms of everything being low. They have anemia from low red cells, a huge infection risk from no functional white cells, and a major bleeding risk from low platelets, which we call thrombocytopenia. Now, to diagnose leukemia, the doctors need a sample of that bone marrow. And while we nurses don't actually perform the aspiration, our role is absolutely crucial. We're the ones managing the child's comfort and safety, from putting on numbing cream and giving sedation to getting them in the right position and then holding firm pressure on that site afterwards to make sure it doesn't bleed. Next up are the lymphomas, which are cancers of the lymphatic system. The key thing to remember here, the big difference, is spread. Hodgkin's lymphoma usually stays put in a single lymph node, which makes it highly curable. Non-Hodgkin's, on the other hand, tends to pop up in multiple places and it spreads easily, which makes it a tougher challenge to treat. Then there's a Wilms tumor, which is a really unique pediatric cancer. It's a tumor on the kidney that actually starts growing while the child is still developing in utero. And a lot of times, a parent just discovers it by accident as a firm lump in their kid's belly or diaper area during bath time. Because of that, this is the single most important thing you need to remember. If you ever suspect a Wilms tumor, you do not palpate the abdomen. I'm serious. The tumor is really fragile, and if you press on it, it can rupture and spill cancer cells all over the body. This is a massive nursing safety alert. All right, we're heading into our final section. Here we'll touch on the immune system with HIV, and then we'll look at a really powerful treatment that's used for many of these disorders, the stem cell transplant. In pediatrics, HIV is almost always passed from mother to child during pregnancy. What the virus does is it attacks a special kind of white blood cell called a T lymphocyte. These are like the generals of the immune system army, so the virus cripples the body's entire defense system. Our nursing care, then, is all about preventing those opportunistic infections that a healthy person would just fight off without a problem. And a really key teaching point, the virus is present in breast milk, so breastfeeding is a no-go. And that brings us to one of the most intense, but also one of the most hopeful treatments we have, the hematopoietic stem cell transplant, or HSCT. Now, pay attention to the wording here, lethal dose of chemotherapy. That's not an exaggeration. We literally have to completely destroy the patient's entire defective bone marrow to make room for a new, healthy system from a donor. The best way to think about it is like hitting the ultimate reset button on the body's blood factory. It is incredibly high risk, there's no question about that, but it also offers the chance for a cure for conditions like severe leukemia, sickle cell disease, and other really scary disorders when nothing else has worked. And this last slide, this really gets to the heart of what pediatric nursing is all about. As we finish up, I just want to leave you with a question to think about as you continue your studies. With all this crazy complex science and these high-stakes treatments, where do you think your most critical role is going to be? Is it in mastering the machines and the medications, or is it in managing the fear, the hope, and the humanity of that child and that family who are trusting you with everything?